Alright guys, welcome again. So, episode 18 of the Kiddo's Tiny Musical Therapy. Perfect pitch and anatomical differences. Perfect pitch, or absolute pitch, is the ability to identify and produce musical note without any external reference note. Research has shown that the brains of individuals with perfect pitch exhibit some distinct differences compared to those without the ability. Here are some key differences. First, anatomical differences. Auditory cortex. Study using neuroimaging techniques have shown that the auditory cortex in individuals with perfect pitch may be larger or more developed. This area of the brain is responsible for processing sound. Planum temporale. This region, which is involved in auditory processing and is located in the temporal lobe, is often larger in people with perfect pitch. These structural differences may contribute to their enhanced auditory skills. Second, functional differences. Enhanced connectivity. There may be differences in how various brain regions communicate with each other in individuals with perfect pitch. Enhanced connectivity between auditory areas and regions associated with memory and language processing could facilitate the identification of pitches. Next, increased activation. Functional MRI studies suggest that when individuals with perfect pitch listen to musical tones, there is increased activation in specific brain areas compared to those without perfect pitch. Number 3. Cognitive processing, memory, and language. Perfect pitch may involve a unique cognitive processing style. People with perfect pitch often have a better memory for sounds. I don't use the word memory because you don't remember sounds. It's in you. Like, it just happens. You don't even remember it. Better memory for sound and may relate pitches for verbal label more easily, suggesting an interplay between auditory perception and language, which means right brain, left brain, and the center. And I want an fMRI. I asked my psychiatrist for an fMRI and CT and all that. So I want to know. Training and experience. Early musical training definitely helps. You can only get it from between 3 and 5 years old. And there's some statistics that I wrote down with non-invasive imaging technique. They found that musicians with perfect pitch has less symmetrical brains than people with no musical training. In those with perfect pitch, a region in the left brain that is known to process language and nonverbal sounds is relatively larger than the same area in the right brain. However, no significant differences was found between non-APs and non-musicians. These results show that the absolute pitch processors score significantly higher than individuals without absolute pitch, perfect pitch, in the autism spectrum quotient. So, they did that with autism because obviously, as I mentioned, autism, because of the late neurodevelopment, they're able to actually obtain perfect pitch until they're about 13, 15 years old. So, if you have a kid that's autistic, watch for his musical training and listen to Cody Lee. Kode, last name Lee. I miss this concert in Toronto. In summary, the brains of individuals with perfect pitch exhibit both structural and functional differences, which contribute to their unique auditory abilities. These differences may be influenced by genetic factors as well as musical training early on and the experience of playing different instruments. All right, thank you very much. See you next episode.